There are some surprising results from a new study by the Women's Health Initiative on rates of sexual activity after menopause. Not only are women continuing to be sexually active in their 70s and 80s, most are satisfied with their sex lives. Here to explain the results of the study is Dr. Donica Moore, president of the Sapphire Women's Health Group. Dr. Moore, thanks so much for joining us.
Thank you.
And I think this is surprising to a lot of women. A lot of people assume that after menopause, women are no longer interested in sex. So first of all, what was this study looking at in particular?
Well, I think this study is going to be more surprising to men than to women. What this study was essentially, it was a component of the Women's Health Initiative, which is the longest running study ever in our country's history. It's a federally funded study of over almost 200,000 women participated. This was a subset questionnaire study to 27,000 plus of those women aged 50 to 79. And it looked at their sexual frequency. So that's one of the glitches in this study, is that they define sexual satisfaction as frequency.
As frequency, which we know as women.
We might have a little discussion about that. But let's just take frequency as a marker of sexual satisfaction. And they asked women, were they satisfied with the frequency of their sexual activity at baseline, at the beginning of their study, at 1 year. And then they took a subset of these women, 8% of them, and re-questioned them at 3 years and 6 years of follow-up. And what they found is the majority of these women were satisfied with their sexual frequency. Of the women who were dissatisfied, 57% were dissatisfied because they weren't having enough sex. And
that's interesting.
And only 8% of women were dissatisfied because their sexual frequency was more than they would like. So those women need to speak up.
Right. Okay, so sexual activity does, though, decrease with age.
Right.
As far as frequency. But the study found that menopause wasn't really the primary cause for that.
Right.
This is the most interesting, I think.
Right. And this, I think the most impactful point of this study is it will debunk that myth that after menopause women are dried up and not interested.
Right.
So of these women who were sexually active at baseline and then no longer sexually active, or their sexual satisfaction decreased at 1 year, the reasons they gave, number one, were loss of a partner. Duh. You know, more than 50% of couples are getting divorced. And of course, women live longer than men and generally marry or become partnered with men who are older.
Right.
So they're certainly more likely to become widowed in this age category. The next reason was dissatisfaction with life in general. And that led to the third reason, which was depression. So dissatisfaction with life in general is, I'm not quite depressed. I'm just mostly upset that I lost my job or my kids moved away from home or whatever it is. And then the final reason was other health problems. Now, of the health problems, and of course any health problem can interfere with your interest in sex or your ability to have sex, but of the health problems, one of the health problems that was clearly an issue identified in women who are not having as much sex as they would have liked is vaginal atrophy, or what we refer to as lay people as vaginal dryness.
Right.
Now, this is a very common problem after menopause. Of course, what happens in menopause is our bodies stop producing enough estrogen, and then everything that is estrogen sensitive is at risk.
But that doesn't affect desire. It affects physically what's going on.
It technically affects your comfort in sex, but that of course can also affect your desire, because if sex is painful or uncomfortable, you're not going to be that interested in doing it again. So of course female sexuality is a very complex situation based on a lot of factors other than what's going on in a small piece of real estate.
And this study specifically, these women were part of a hormone replacement therapy group.
Right.
Was there any discrepancy found between women receiving hormone therapy and those that weren't? Any differences?
Yes, that's a great question. What they found is that at the 3-year follow-up and the 6-year follow-up, the women who happened to be on hormones did report greater sexual satisfaction with the frequency of their sexual intercourse.
And
or their
could
sexual
that have
activity.
been because of some of these physical issues?
Absolutely. And most likely because of very specifically the vaginal atrophy issue, because of course the gold standard for prevention and treatment of vaginal atrophy is estrogen cream or estrogen therapy. Of course, any woman who's watching this who has vaginal atrophy or vaginal discomfort of any kind needs to talk to her gynecologist. But I think we all need to think, and I'm in this age group now, you know, so all of us at 50 to 79 and older need to think about, are we satisfied with our sexuality? Are we satisfied with our sexual relationships? And if not, okay, what are the steps we need to take to improve them?
Do you think in the end this sort of has implications for treatment and how we view women in this age category and their sex lives?
Well, I think the first thing it has is implications for the questions we ask women and the assumptions that we make. I think there are many doctors who don't even ask women over 50 about their sexual satisfaction. They think, okay, that's would be insulting,
right,
or it's not something they care
relevant.
about.
Yeah.
Right. I think also women in that age group may need to speak up to their doctors if it's a medical problem. And this study identified 3 major medical problems that can interfere with your sexual frequency. Certainly depression, vaginal atrophy, and then the whole host of other, which is everything from chronic diseases to orthopedic problems.
We'll have to leave it there. A very complicated topic, but an interesting study. Dr. Donica Moore, thanks so much for joining us.
Thank you, Stephanie.